So I think there's a lot of kind of nuances to that discussion. So the first is the reason for the third dose. So we know that in some individuals with medical conditions that compromise their immune system, they received a third dose because their immune system just didn't have the same reaction to only two doses. The other large group that we're talking about third doses for are those people that are at higher risk of more severe disease. So two doses, they got the effect that we need from it, but there is some preliminary studies showing that the antibody levels or immunity levels might decrease over time. So would a third dose then bring those immune levels back up? What the studies to date have shown is that even if we're seeing a little bit of a lowering of immune levels after 5-6 months from their second dose, they're still very protective against severe disease, hospital admissions, and ICU. So from my perspective, the rush to get that third dose isn't there. We know that they're still protected after those two doses, especially against severe disease. But because there's so many unknowns still with COVID, and if we were to see an increase in the number of cases that we're having, we certainly want to make sure that those people that are more at risk of severe disease are as protected as they could be. I think we also want to make sure that, vaccine is being made available globally. And so we know that the more COVID spreads, the more opportunity it has to mutate or develop variants. And so there's many places that haven't had the opportunity to access vaccine yet, where COVID will continue to spread. And the pandemic will continue on as long as there is COVID that's spreading quite easily. So globally, if we want to really stem this pandemic overall, we need to see vaccination available everywhere and globally to bring that down. So I think there's lots of ways to look at it, but certainly anticipating that we'll start to see expanded eligibility for third doses here in Ontario relatively soon.